The founder of the most valuable company in the world said AI agents are a $1 trillion opportunity. And in healthcare, they're already getting put to use. But good luck getting a straight answer on what they actually do, because every article right now about AI agents in healthcare sounds like a hyped up ChatGPT written press release. This isn't just automation, it's an always-on digital workforce revolution. So I decided to try to go beyond the hype and the ChatGPT enhanced memos and research some of the early uses of AI agents in healthcare. I've identified 3 that I think are worth sharing, along with the risks associated with each one. Let's dive in. Despite public statements like this one, AI agents are actually working to solve 3 pretty big problems right now in healthcare. One of the main reasons that healthcare is so expensive for companies and just about every other working adult in the US is administration. Think somebody checking to make sure your insurance is active, calling about a prior authorization for surgery, or just trying to schedule an appointment. The US spends $1,000 per person on health administration, roughly 5 times more than what most wealthy nations spend. A 2017 study estimated US healthcare admin costs were around $1.1 trillion, and they've only gotten higher. And that ridiculously high number is a major reason why you, or maybe it's your boss, pays a lot of money every single month so that you could have health insurance. To address this, a company called Notable Health built AI agents that work within hospital systems similar to how a human might. But instead of training each worker manually, hospital IT systems use a drag and drop interface to map out the tasks for the AI agents. So open this screen, read this field, check insurance, so on. Normally, when a referral comes in, a staff member has to read and interpret it. They check coverage, get authorization, schedule an appointment, and then they notify the patient. It can be very time consuming. But according to the company, once Notable's agents are properly set up, the entire workflow can run on its own. The AI moves through each step automatically, and staff only steps in if something needs a human decision. Right now, they're automating 1 million tasks per day, which sounds like a lot, but in the big scope of healthcare, that's really nothing. The one big risk though is if a process is set up incorrectly and then it gets automated, that mistake will be repeated over and over again, basically causing chaos within the system. The US healthcare system as it's set up right now is built to respond after something goes wrong. Despite terms like preventative care, most of the system's actual operations happen downstream, once patients are already sick or in crisis. And the result of that is avoidable harm and massive cost for everyone. And this is particularly true for patients that were hospitalized and released. Nearly 1 in 5 Medicare patients is readmitted to the hospital within 30 days after they leave, costing anywhere from $26 to $28 billion a year. And one big reason why so many are readmitted to the hospital is hospital nurses and admin don't have time to check on every single discharged patient, even though the first 48 hours after they're discharged is when many complications start. And this is understandable because they have high-risk patients that they need to take care of that are actually in the hospital. So to address this, Universal Health Services, one of the largest hospital systems in the country, partnered with a startup called Hippocratic AI to fix that chronic problem. Hippocratic's AI agent, named Daisy, now makes those follow-up calls after patients leave the ER, inpatient units, or surgery. It'll pull the patient's discharge instructions and medication list, check for symptoms, confirm appointments, and make sure that the patient understands what they're supposed to do next. And if anything sounds off, the AI will flag it for a nurse to review. One of the issues with these AI agents, and really with all this new tech, is what happens when it mishears something. Maybe a patient says bad pain, but the AI agent hears back pain. Back pain isn't of concern for that patient's condition, so maybe it doesn't notify the nurse. In fairness, this might actually happen quite a bit when nurses call patients during those first 48 hours, but are we willing to accept potentially life-altering mistakes from AI agents at this point? In addition to being the most expensive healthcare in the world, US healthcare is painfully complex, meaning our wait times for approvals or prior authorizations can get absurd. The American Medical Association conducted a study of roughly 1,000 doctors. 94% of them said that prior authorizations led to delays in assessing necessary care for patients. And 1 in 3 of those doctors said that those delays led to serious adverse effects for those patients. To avoid those delays, 35% of those doctors reported employing staff members to work exclusively on tasks associated with prior authorization. Basically, when the insurance says we won't pay or approve something until a doctor signs off that you really do need it. So these employees are hired to sit on hold with insurance companies, chase down updates, call to confirm basic coverage details over and over and over for tons of patients. To handle this, Infinitus built voice-based AI agents that make those calls automatically. Their system can dial into more than 200 major insurers, so Cigna, Humana, Aetna, United Healthcare, Blue Cross plans, and walk through the same steps a human would. They could verify benefits, check the status of an authorization, follow up on a claim, and quite a few things that are unrelated to prior authorizations as well. Over the past few years, Infinitus says that their AI agents have handled over 5 million calls and saved workers 100 million minutes of time. Although this doesn't change the bigger issue, which is the system of prior authorizations, this may speed them up and get care to those who are just waiting for healthcare approval for financial reasons. But the major risk with these AI agents is really the same reason why we don't have self-driving cars everywhere right now. The basic repetitive question and answer stuff is easy. It's the weird one-off cases known as edge cases that really do break things. So let's say there's a new insurance form from one of the companies, a rep goes off script, or a phrasing that the AI hasn't seen before. It won't happen that often. By definition, it's an edge case, but when it does, it could have major repercussions in healthcare. If you found this video interesting and you'd like to see more like it in the future, please consider subscribing. This is Tyler Dutchover. Thanks for watching.